This is WAB's Week in Review, the show where we look back the last few days of stories from your WAB News team. I'm Alex Helmick, managing editor of WAB News. And today we start with Fulton County taxpayers possibly being on the hook for millions of dollars of legal fees after a judge dismissed the 2020 election interference case involving President Donald Trump. As WAB's Raul Bali reported, it follows Fulton County District Attorney Fani Willis losing her final appeal to stay on the case.
Trump's lead Georgia defense attorney Steve Sadow took to social media to say they would be pursuing attorney's fees and cost. A new state law allows for it in cases where a prosecutor is disqualified due to improper conduct and the case is dismissed. The legislation was authored by then Republican State Senator Brandon Beach of Alpharetta, who is now serving in the Trump administration as treasurer. Lawyers for Trump and remaining defendants have a little more than a month to file a motion for, quote, reasonable attorney's fees and cost. Then Fulton County Superior Court Judge Scott McAfee will decide how much they get, with the sum coming out of county taxpayer funds that go to the district attorney's office. Raul Bali, WABE News.
Well, after months of public hearings on the issue, the Atlanta Board of Education has voted to either repurpose or completely close 16 schools over the next couple of years. WAB's Lily Oppenheimer had the story.
Most are elementary schools on the west side and in South Atlanta. Some will close, others will merge. Opponents have warned that the plan, known as APS Forward 2040, will destabilize education in the communities where the schools are impacted. Atlanta Public Schools officials say the plan will save the district roughly $25 million a year just in operational costs. And APS says it's also because enrollment is down. According to an APS report, the district is only using about 65% of its seats, and numbers are projected to hover around that until 2030. Lily Oppenheimer, WABE News.
Note of disclosure, the Atlanta Board of Education holds WAB's broadcast license. Traffic crashes killed more people than homicides in the 5 core metro Atlanta counties in 2024. That's according to a new study, and Marissa Mecki brought us the details.
Local nonprofit Propel ATL's Cost of Mobility report highlights the scope of traffic deaths and human impact of these losses in Atlanta. The organization works on transportation advocacy initiatives like street design, transportation and transit, as well as events like Atlanta Streets Alive. Jeremiah Jones is the advocacy manager for Propel ATL.
We noticed that overall traffic crashes did reduce last year. But pedestrian and cyclist fatalities actually increased.
The Cost of Mobility report for 2024 found that across the city of Atlanta, DeKalb, Fulton, Cobb, Gwinnett, and Clayton counties, traffic crashes killed 425 people, just over the number of people killed in homicides in the metro area. Jones says this number is unacceptable and that crashes aren't accidents.
We believe they're choices. And we believe that decision makers have the ability to choose different designs for these corridors. And when we begin to prioritize, safety and protection and lives over speed and the flow of traffic, we can begin to save lives.
But Jones says change is possible. He says Donnelly Hollowell Parkway was number 8 on the list of roads or corridors that had the most crashes for several years. But now
it has dropped to 19 on the list now. And that is due to GDOT implementing a safety-oriented redesign on the state route.
He says updated designs, pedestrian infrastructure, and measures to slow cars down can effectively reduce mortalities. By highlighting traffic deaths and where they happen in this annual report, Jones says the Metro Atlanta area can use this data to make planning and engineering decisions to reduce preventable deaths. Marissa Mecki, WABE News.
A new women-only facility is opening in DeKalb County for those experiencing homelessness. As WABE's Marlon Hyde told us, a local nonprofit is expanding its housing and workforce program to include women.
53-year-old Risa Saville has been unhoused since October of last year.
It takes all of your energy to be unhoused because you're concerned about where you're going to sleep. Is it going to be safe?
She was incarcerated, and although her charges were dropped, that was only the beginning of her struggles.
When they let me out, what did they do? They let me out with absolutely no plan, no ID, no clothing, No, nothing.
Saville is applying to be one of the first residents of the newly opened DeKalb County Women's Workforce Development Program. If she's admitted, she'll be one of 11 women who will get their own room with the basics: a bed, a dresser, and a nightstand. Georgia Works, a nonprofit working to end homelessness, partnered with A Home for Everyone in DeKalb and the Oakhurst Center for Community to start the women's program. Princess Futrell is the executive director of the Oakhurst Center for Community.
We're really looking forward to being that catalyst of where the women can come in and be able to overcome the situations that they're currently in.
Darlene Schultz serves as the president and CEO of Georgia Works. She says a program like this is long overdue.
I started tracking last August, not this past August, but the August before, and I was getting over 100 calls per month from women who said, I've heard about the Georgia Works program for men. When are you going to have one for women?
After 6 to 8 months in the program, the women will graduate with the job offer. And
we give them their savings account, and then the beauty of what we do is we make sure that they have permanent housing to move into.
Organizers say they have begun the interview process and expect to move the first group of residents in by January. Marlon Hod, WABE News.
Georgians who need help paying high winter energy bills could see delays getting that money because of the recent government shutdown. WAB's Emily Jones reported the story.
Many seniors and other low-income households rely on the Federal Low-Income Energy Assistance Program, or LIHEAP, to pay their bills as temperatures get colder. The program is administered by local community action agencies, which typically spend the fall ramping up operations so they can open the assistance program in December. But that's exactly when the federal government shut down, stopping the money those agencies count on. Consuelo Thompson of the Georgia Community Action Association says many had to dip into reserve funds to keep operating.
We had to really hold it down for a lot longer than anticipated. We're having to do damage control and build back up resources.
Thompson says they expect to have the money people need, but it might take longer than usual to dole it out. Emily Jones, WABE News.
You're listening to WAB's Week in Review with me, Alex Helmick. More than 1.5 million Georgians have ACA health coverage through the Georgia Access Marketplace. Now, unless congressional Republicans and Democrats agree on an extension, enhanced premium tax credits that have made that marketplace coverage more affordable are set to expire at the end of the year. Health policy research organization KFF estimates the change would push many people's monthly out-of-pocket premiums up by more than double on average. As part of our series Medical Wealth Gap, looking at Georgia's shifting healthcare landscape, WAB health reporter Jess Mador spoke with certified enrollment assister Deanna Williams to hear how she's advising Georgians on their options.
What are some examples of some of the increases you're seeing among people in Georgia who have their health insurance on the marketplace?
I can give you 2 examples from clients I've worked with most recently. One of my clients was paying about $19 a month for her coverage. And for 2026, her coverage will be going up to about $97 a month. For another family I'm working with, they were paying $1,300 a month previously. It was going up to about $3,100 a month. So having to decide about paying such a high premium for health insurance that also has other costs associated with it, some may make the decision not to have coverage. And then I have to look to see what other resources may be available for them.
What resources might be available for people who are in this situation?
I try to screen them to see if there's been a decrease in their income, see if they're eligible for Medicaid or Georgia's Pathways to Coverage. But for others, they may consider, well, I may just go to the federal qualifying health centers or go to other sliding scale clinics for their services. And a lot of people are also asking questions about direct primary care, where you can go to a specific primary care physician and you pay the doctor directly. You pay them a monthly fee. So that kind of cuts out the need for insurance billing. People are trying to see which way they can still get the health services if they can't afford to get this insurance.
So you've been doing this insurance assisting work for many years. You know, you get calls all day long from people all across the state looking for help with their health insurance. Who are you seeing that could be most affected by this increase in costs?
I work with families and individuals who had higher incomes, but I would definitely say those who are right there on the edge or right above 100% of the federal poverty limit, and they're seeing such major increase, I would say they would be more affected because it can be a big difference in your household just trying to decide whether or not you're going to be able to pay a light bill or pay for your monthly health insurance.
What could losing that health insurance mean for Georgians, especially in the middle of the state where you're based?
They're going to go to the emergency rooms for care because typically the emergency room can't turn you away. And it's going to also overwork the sliding scale clinics or even volunteer clinics. They're going to get an increase in the influx of people coming to receive services there because they no longer have health insurance.
What are your recommendations for people who might be facing these steep increases and don't know what to do next?
One of my biggest things is just compare plans beyond their monthly premium to make sure that the plan shows them their total cost picture, co-pays, deductibles, and coinsurance. A lot of people will just pick the plan based on the monthly premium and then later on find out that the plan doesn't necessarily cover everything that they need for their health. Their specialists or not covering all of their providers. Please don't just stick with the auto enrollment. Please go back in and review your application to make the adjustments if there's been changes in your household when it comes to size and income.
That was WAB's Jess Mador speaking with Health Insurance Enrollment Assister Deanna Williams. And in our second part of the Medical Wealth Gap series, we look at families in Georgia facing uncertainty over how the Trump administration cuts to federal health funding could impact their access to the services they need. H.R. 1, or the so-called One Big Beautiful Bill, slashes health spending over the next decade by more than $1 trillion. And Georgians who rely on Medicaid disability programs are trying to make sense of how their lives might change. WABE's Christopher Alston had more.
Hey.
How are you?
Good, I'm Jackie.
Jackie, nice to meet you in person.
Hey, Kristen. What's up? How are you?
Good. Nice to meet you, Aaron.
Nice to meet you, too.
Jackie Rexon says her son has a birth condition that affected the growth of part of his brain that translates information. Early on, it meant he was slow to walk and talk. As an adult, Aaron struggles with behavioral and emotional control. He's 24 now and leads a pretty busy life. Aaron works 1 day a week at a coffee shop in Roswell that employs adults with developmental disabilities, where he demonstrates his skills as a barista.
I'm using this ice and...
You want the chocolate in there, right?
Yes.
Okay, here.
Wait. Where is the,
You want an espresso in there?
Yeah.
He also competes nationally and internationally with a Special Olympic powerlifting team. But 4 days a week, Aaron goes to Bloom, a day program for adults with special needs. The cost is covered through the state's Medicaid program and funded through a mix of state and federal Medicaid dollars. Without the assistance, Rexon says, she would be unable to afford the program's cost of almost $20,000 a year. She says losing it would be potentially disastrous for her family.
If he didn't have access to the day programs, he would basically be sitting at home on the couch all day, doing nothing, playing on his video game or sitting around doing nothing with no social skills. And that is not good for his mental health.
While funding for Aaron's program remains in place for now, disability advocates are sounding the alarm that cuts to federal Medicaid funds could put the services at risk. Republican Congressman Rich McCormick says cuts are necessary to curb what the administration calls waste, fraud, and abuse to preserve care for the most vulnerable. He says people like Jackie and her family have nothing to worry about, calling claims to the contrary, quote, fear-mongering.
What we did in the Big Beautiful Bill, whatever you want to call it, has nothing to do with people like that. This is never, ever going to affect those people.
For their part, Democrats say the administration's cuts will harm millions of at-risk people to cover tax breaks for the wealthy. Senator John Ossoff says the healthcare system is already facing deep cuts.
These Medicaid cuts are putting Georgia's healthcare system in crisis mode.
What is clear is that state officials are going to have to wrestle with difficult decisions, like where to find state money to make up for lost federal Medicaid funding, says Georgians for a Healthy Future Executive Director Laura Colbert.
Often the services that are used most by people with disabilities and seniors are the first to get cut when Medicaid budgets get tight because they are often the most costly.
Meanwhile, Rexon herself remains uncertain about the future of the program she relies on to keep Aaron in his community.
I just don't trust. They're going to have to cut somewhere so that I can get an assurance that he's safe. That would be great, but I don't trust.
The Trump tax and spending law does include a provision allowing states to create a new Medicaid program for adults with disabilities starting in 2028, but there's already a years-long wait list for existing services. Advocates say it's unclear how feasible it would be for new participants to find providers under that plan. Christopher Alston, WABE News.
And our series Medical Wealth Gap continues all next week on All Things Considered and at WABE.org. And that's all for the show today. My thanks to the WABE News team, and a big thanks to all of you. Your support on Giving Tuesday was inspiring and helps keep the journalism here at WABE, your local public radio station, going strong. I'm Alex Helmick. Thanks for listening to The Week in Review.